What does living well mean to you? Today, we are talking to Anna Chassevent, a genetic counselor, cancer survivor, and mother to a child with developmental and behavioral delays. Anna talks about why a diagnosis isn't the end of a patient's story and the importance of connecting meaning to medical information. We discuss the emotional weight of navigating uncertainty and the use of logotherapy in genetic counseling. Let's get started. Welcome to the podcast, Anna.
Thank you. I'm so happy to be here.
I'm thrilled that you could talk with me today. And I wanted to give some context to our listeners because I found you via LinkedIn. And the reason I reached out to you was because I was reading your writing about the importance of walking alongside families as they face unknowns and supporting them in living well, whatever that means to them. And that writing really resonated with me as somebody who's also worked with patients and provided genetic counseling. Tell us more about why this area is such a passion for you.
Yeah. So I think this has evolved over my career a lot. I mean, even from very early on as a student, I mean, my undergrad is in psychology. And so I always, I think, came to genetic counseling with more of a maybe psychosocial, if we're going to use these terms, perspective. But then really my like lived experiences over the last few years kind of like deepened that passion and like just how important it is for like the information we give. It's just if it's just information, it doesn't really matter, honestly. And I think even before some of and I think we'll talk more about this in a minute, but even before some of my experiences as a patient, I would give results to families. So I work in pediatric neurogenetics. And so I'd give an exome result, and those appointments would feel like they should be so much deeper than they were. Like I would feel like I'm giving this big news, but families would receive it as like just overwhelming. And I was like,
Right.
this is there is something missing here. And so then kind of going through my experiences as a patient, I was like, I need to think more about this and struggle more with this, and we need to do this better. So yeah, that's kind of where how I've gotten to where I am.
And you mentioned that it was working with the patients, but then also you had personal experiences. So I was wondering if you could share some of your story with us and how that impacted the way you wanted to offer genetic counseling services.
Yeah. So I think of this as kind of from like two different sides of my story. So that really have shaped in many ways how I work with families now. So about 4 years ago now, I was diagnosed with breast cancer myself. I was early 30s, didn't really have a family history at all. So it was very much out of the blue. And just being a patient myself and getting that news, really hard news, similar, I mean, different but similar news that I give patients just completely reshaped, well, kind of completely reshaped, but also kind of validated some of the like things I was feeling before my diagnosis of like, this isn't working. This like something is wrong here. And then I'm like, okay, now I'm a patient. And yeah, like it's not working for me either.
Right.
And so, yeah, that experience of hearing hard news, processing hard news, people giving me information. And I think it was also really impactful for me because like I knew the information about cancer, like that's part of our training. Like these are things that we know and I have all this experience on. And yet still when I received that diagnosis for myself, I've shared this with other people. I got the diagnosis, and when the doctor called me on the phone, she said, it's malignant. Like the result is malignant. And I got off the phone, and she never said the word cancer. I got off the phone. I was like, malignant is cancer, right? And just like that, like I know this. And yet
Right.
as a patient, when you're receiving it, you doubt everything that you hear. And so um I think even just that one experience of like, okay, the information didn't mean anything. I needed to like understand how this like fit within my life and what this would mean for the next few months. And as a long-term cancer survivor, what would this all mean? So that experience. And then also, well, we recently adopted our daughter from foster care, and she has some developmental delays. And just again, going to appointments with her and navigating all of the medical systems and education systems and all the systems and getting information and trying to process that and then relay that back to her biological family and DSS and make it make sense for everybody involved. I don't know, just both of those coming together are kind of where I'm like, okay, we need to do this better. I keep saying that we need to do this better. And yeah, so they've brought me where I am now. which I don't know. I'm still learning. I feel like I so much feel like I'm an imposter with all of this because it's still organically growing and I'm learning on this journey.
Right. Well, and I think it should be. I think if you've gotten to the point where you're like, boom, solved it, figured it all out, then it's
Mhm,
like, I don't know if we ever get to that point in some of these
mhm.
areas, especially in working in clinical care, because it's things are
Yeah.
always changing and evolving. So it's interesting that you felt as a provider the sense of, I'd say maybe like a disconnect or something that wasn't quite bridging that gap between what the provider was saying and what the patient was taking in or hearing or kind of what they were doing with that information. And you were kind of thinking it over, but that it really struck you once you had moved to the other side where the patient were like, I'm sensing it on both sides. So it's not just me as a provider sensing it, I can sense it on both sides that there's something missing. And when you started exploring this kind of disconnect or needing to do better, what were some of the things that you were thinking needed to improve? Or kind of how did you initially say, this is what I'm going to set as my goal or I'm going to try to work on? Like, because it can feel very nebulous just saying something's not working, but where do I
Yeah.
start?
Yeah. Yeah. I think it's really like going back to the living well. Like, how do I take this information, make meaning out of it, and then incorporate it into my life in a way that I can be proud of, in a way that, I mean, on the opposite side, doesn't destroy my family, doesn't destroy who I am.
Hmm.
But really, I mean, we see these patients who you're like, how are you going through all of the things that you've gone through? And yet you've managed to find a way to like make it make sense and not find your whole identity in it because that's also kind of a danger zone, but find enough identity in it that you can use it for good. And that's also nebulous because that means something different to every patient. And so that like I know people can do it. And I, as a genetic counselor, want to be a small part because I'm not going to do it. We don't have a ton of time with families. I'm not going to be a huge part in that process, but I want to be like a small part in helping the family towards those goals. And that's where like I've taken some courses on different counseling styles and they have kind of helped shape and give me a perspective and good questions with all of that. Yeah, but really that like how do I be proud of myself with this information? I think is a question that I think about a lot.
Hmm. Hmm. And so you're talking about making meaning and you're sitting with people, like you said, you're giving them potentially life-changing news, some things that can be very out of the blue, some things that maybe are happening that they were hoping wouldn't happen. So the story's shifting, they're in a period of change. Does having this meaning-centered approach or working on this meaning affect how you have these conversations or how you show up in those conversations?
I think it shapes like what's important within the conversation. And it shapes like what I'm listening for and asking from the family. So it might be that we ask, even within like a family history, we ask the same questions, but I'm listening for what the patient is telling me is meaningful to them. And so that might mean that their family is hugely important to them. They might be somebody who loves serving others and like they tell you that in multiple ways by things that they're doing or by how their cousin is living with them or and so then taking that and saying okay I hear that and I'm going to then point out that like this is a meaning thing in your life. And so it might be caring for a family member is hugely important. So then you caring for your child is, yes, incredibly hard, but it's also something that you get meaning and purpose and value from. And so it's not like if I can turn that and work with the family to kind of see that like there is good in this. And it's not, I've talked about this a lot with colleagues. It's not just a silver lining of like, oh, let's put a like happy sticker on it. This is not as hard as it is. No, this is incredibly hard. But it is we can be the people who we want to be through this experience and be filled through the things that you are doing and caring for your child. And so like listening to that, repeating it back to families, asking questions, like curiosity questions to explore of like, oh, you're caring for your cousin where we might normally just, if that came up in a family history, move on. but be like, oh, tell me more about that experience. Like, how did you get there? Why were you compelled to take care of your cousin when somebody else could have? And then getting like, because then that question kind of gets at why they're doing it. What about caring for their cousin is what speaks to them, which is even different from person to person. So they might be doing the same thing, but their motivation for doing that same thing is different. And hearing that from the client, then when we go to give a genetics result or consent for testing, we can talk about, well, why are we making this decision for or against testing? Does it align with those values that you've already told me are important to you? And we can shape the conversation and shape the information that we give in a way that relates more with the family, is more engaging for the family, and is more meaningful to them.
Right. Well, and it relates back to them. And I think you mentioned something very important about the values in the decision, because that's one thing with genetic counselors is we try to do this what we call informed decision making,
Mhm.
right? So we're not telling the patient what to do, but we're helping to provide the information that they need. But also some of it is not the medical information. It's helping them uncover how they've handled challenges in the past or what values mean the most to them that factor into making decisions. And you mentioned something interesting about not putting a silver lining or not just staying positive in terms of being the provider. I would also say, how do you handle that when a patient is the one putting it in those terms? Because I think we've all worked with patients who are struggling to make sense of this
Mhm.
news. And while staying positive or finding the positive can certainly help and move people forward, there's a part where it sort of tips over into being too positive and not necessarily recognizing what's happening.
Yeah, yeah. I have lots of thoughts on this. So one of the courses that I've taken, a series of courses, is in logotherapy. And in logotherapy, they talk a lot about tension and how tension is not bad. And tension can be a really beautiful place for more exploration. Like when you see these two things seem to both be present and yet kind of are at odds, but they're not, like logotherapy, like we maybe in our logical minds would say they're at odds. But the logotherapeutic perspective would say, no, they can be both present in tension and like even helping each other out. So I say that because like when a patient comes to us and they seem too positive, more positive than they should be, there is this tension and like, okay, we can lean into the positivity side, but then like acknowledge, okay, yeah, but tell me about the times when that's not working. And I think that also is where like my perspective of being a patient and parenting a child who has extra needs does come in, because I can kind of kindly, and I don't always self-disclose, but even just like how I've like, been there, I can kind of like call a patient's bluff in maybe a way I think, especially a student, I work with a lot of students, a student would not feel comfortable doing. But I can be like, no, really, like, let's be realistic. It's not always peaches and rainbows.
Mhm.
So what are the times that is not? And let's talk through those and what keeps you going in those moments. And maybe it is staying positive that keeps you going in those moments.
Yeah, and I think it's important to be able to, even if you don't have a personal experience, but as a provider, you're giving permission to say, it's okay to say that there are times that are hard
Mhm.
because I think sometimes too there is sort of a guilt or a shame or something. And I'm just thinking me myself being a parent where you're like, I can't do this. But it's hard to admit that sometimes
Yeah.
or it doesn't feel comfortable to say that out loud.
Yeah.
What do you say to patients when they say, why me? What now? How do you provide, and again, you mentioned working with like students. I think as an early genetic counselor, you're trying to provide support, hope, reassurance, but you don't want to provide false comfort. So how do you address those questions when people are like, why did this happen to me? Or what's going to happen now?
Hmm. Yeah. I think those are pretty distinct questions. The why me question is interesting because I don't really feel like I hear from families a lot like a why me, like within like a sense of cosmic justice. So like why me type of
Right.
question. I do think that is a lot of the like, is it genetic? Is it not? Did I eat something? Did I not? Why me? I hear that. I feel like from almost every family that I talk with, and some of that's because we're talking about ordering genetic testing and etiology questions, like why did this happen? I don't really feel like I hear, and this might be the specialty that I work in. Maybe I should ask different questions. I don't know. I don't really feel like this, like, why did this happen? Other than, I mean, do have a few families who have had, um, like multiple diagnoses in the same child, and maybe they start to express some of that. The what now, though, and I think the what now kind of gets back to the like living well type of concept of like, okay, now what do you want to do? Who do you want to be? And I mean, I have asked patients that question. Like, we've talked about the information, we've talked about like 10 years from now, you've now had time to adjust to this information. Maybe it doesn't take 10 years, 5 years from now, you've had time to adjust to this information. What are the things you want to look back on and say, I did a good job with that? And maybe I'm not going to promise that there's going to be a therapy. I'm probably going to tell you there's very small likelihood that there's going to be a therapy that's going to change the course of your child's condition. But like, how do you continue to live every day in a way that you're proud? Going back to you're proud of,
Hmm.
and get really specific. Like, what does that mean when you wake up in the morning that you're doing? What does that mean that when you look at your child and you feel it in your body, you're feeling? And really pushing families to explore those things and think about those things.
I love that question about 5 years from now, 10 years from now, when you've adjusted to this, what do you want to look back on and feel like most proud of? And thinking about it in that light, because I think one of the things that's challenging, and I think we talk about it a lot in terms of like pediatrics and giving somebody's like child a diagnosis, but you also see it in other specialty areas as well, with the patient in front of you, where it's this change in how you thought life was going to be, right? Pre-diagnosis, post-diagnosis. You thought life was going on this one pathway or one trajectory, but then it shifts. And so I love the idea of saying, okay, it shifted. And then down the road, looking back, how do you view that? Or how do you want to view that? Because I
Yeah,
think it
yeah.
does help perhaps maybe let people have that conversation eh, out of that circle of grief, perhaps, for the
Hmm.
life they thought was going to be one way.
Yeah, yeah, and give time for that cycle of grief, and that cycle of grief is going to happen over and over and over again. And again, with this tension, like, you can both be grieving and be joyful and proud at the same time. And both of those things are true.
How has living well, how has that definition changed through your work? Kind of like you
Mhm.
said, all right, something's not working. And you're thinking about the living concept of living well. How has that changed over the years? What does it mean to you today?
For me personally, or for my
Yeah,
patients?
for you personally.
Whew, that's a big question. I don't know that it's changed. I think it's like focused through all of the things that we've gone through, but there's still a lot of lack of focus at times too. But like, I mean, you come out of school and there's so many like dreams and hopes and thoughts, and this is who I'm gonna be. And then life hits you and you're like, okay, like these are the cards I have. And so I think, I don't know if this exactly answers your question either, but like, also going through, we had I had cancer at the same time our daughter was going through a really critical mental health concern. It was really, really tough. There were like 10 things that happened all at the same time. And going through that and being like, I survived and we got through it and we're here, I think made me appreciate the like resilience of humanity even more. And even my own, like, I look back on that self, I'm like, I don't know how you survive. Like, today I get upset by the dishes not being done. And you somehow had all of these things that were like crashing upon you at the same time and yet persisted. And so I don't know if this gets at your question, but I do think like over time I've come to appreciate just like how resilient people are and how resilient my patients are. I think especially when I was new in my career, I was like, I don't want to say the wrong thing. I don't want to do the wrong thing. I don't want to like, this is going to, I don't know. And maybe I need to save my patient. I need to rescue them by doing all these things. I think we do a disservice to ourselves because that, like, as genetic counselors, we don't have enough time to do that for every family. Mental health wise, for ourselves, we can't do that for every family. But also for our patients, we do a disservice in trying to save them or trying to like do all the things for them. And so, like, just recognizing that humans and the patients sitting in front of me, I'm going to give them, like, I'm there to help them. I'm going to support them in the ways that are within my scope of practice. but I don't need to do all the things. And they are resilient and they have been living this life up until this point and making it work. And so, how can I give them a few more tools to help them move forward a little bit more? So, I think that's how I'm a little bit different now. I don't know.
Yeah. Well, and I think too, you talked about like maybe the foundational of living well hasn't necessarily shifted in terms of what it means because I think a lot of our values continue to kind of remain the same. But there's also, I think the focus, the way you say it with focus, maybe it's more of a, I can specifically say these are my values. This is what is
Hmm.
important to me. So again, it's, we kind of have a sense maybe, but we don't always define
Hmm.
what it means to live well. Like we kind of know that this is what I gravitate towards, or this is what makes me feel better, more aligned in my life.
Hmm.
But maybe
Yeah.
we can't necessarily name it earlier on in the career.
Yeah. Yeah. And I think I answered the question more for patients than for myself. For myself, like so I'm religious and I have always like been very like I don't know. It's hard to explain religion and where you are in that spectrum, but like theology has always really made a difference to me, like who God is and the truths of who he is and the purpose that having a faith brings to care for others and to bring glory to God and to through caring for others, like that was always there. And then life has been like, okay, no, this is really what this looks like. And these are ways that you've seen other people do that for you. And so maybe you can pay it forward in a way. And having those experiences like gave clarity to what that looks like as far as working with clients or working with friends or just living each day, caring for our daughter.
Well, and thank you for sharing that. I think that's it's helpful to know. Again, it's kind of also what we would do with our patients is some of the questions we may ask is, do you have beliefs? What are those things that, again, kind of some of the bigger questions, not necessarily like existential questions, but bigger questions in terms of, what do you feel your purpose is, or when you're in times of strife, what do you turn to? And I think for many different folks, it can be religion. And I think it's important for those that are as patient and provider to acknowledge providers also are trying to make meaning
Hmm.
of not just
Hmm.
their life, but also their interactions with their patients. And they always take some piece of that with them. There are moments in genetic counseling because we've been talking about like, making meaning, shared going through the decision making. Are there moments where you have to balance those psychosocial conversations? Like, tell me the example you used earlier, like, taking care of your cousin, right? How do you balance that with giving more like of the medical information or the kind of educating piece? Is there ever a time where you're like, the education piece right now is not that important and I need to really focus on more of this kind of like psychosocial? And how do you navigate those kind of two things?
Yeah, yeah, all the time. Like is when I would default to the caring for where the client is at right now over sharing information. I think some of that is I have a lot of flexibility in my current role where I can have a client come back. Like if I see them to have a conversation, I mean, just yesterday I saw a patient and I was like, there's more that we need to unpack. And I'm going to have an appointment with them next week. So I feel more freedom maybe than other clinics and other hospital situations to do that. But having been a client and having been a patient and sitting in those shoes and having information poured over you in a way that you're like, I don't even know what you're saying and I don't even care. Like why? Really like if I'm going to share a piece of it, I think in our training, we're like kind of taught that like give the information and then only counsel if necessary. And mine is like flipped of like, if I'm thinking like, do I need to ask this more psychosocial question? And again, I'm air quote psychosocial. Am I going to ask this more counseling question? I will just try that. And if I'm going to give a piece of information, I'm going to think about, is this really necessary for the patient? So it's like a switch from maybe what we're taught. But the reason is from my experience and then as a patient, and then also like again and again talking with clients and finding that if I can figure out and like unpack and uncover with them, like what the important things are, what their meanings are, then the information that I give becomes so much more powerful. And I'm not wasting my time talking about all this information that is maybe even frustrating them. I remember appointments that I sat in where I was like, why are we doing this. This is not a good use of my time. This is not a good use of your time. And I think our fears, again, our fears are flipped, that patients are going to be like, well, why are they asking these counseling questions? Where we don't worry often about, well, why am I giving all this information? So yeah, definitely default to the counseling question. And again, I've seen where like the counseling question has what I am saying and how to say it in a way that relates to the family best.
Right, because I think part of it too is the information, some of it doesn't seem needed or is irrelevant because, again, it's not what they're looking for or what matters to them at that
It's
moment
not
in time.
important. Hmm.
Right, and so you have to kind of do that teasing out to then figure out, okay, here's the information that is most helpful at this point in time.
Yeah.
One of the things with genetic counseling, I think again with any kind of, being in clinical health is that it's extremely emotional. Some days more than others, depending, but how do you find support in carrying this emotional weight? How do you handle it and try to keep it from influencing your own emotions?
Hmm. Yeah. 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 So baseline, it's going to influence your own emotions. um, and I think that's not a goal that I have. Like my goal for myself is that when it impacts my emotions, that I have tools to unpack that and get to a place where I'm proud of the work that I did, where I feel like maybe I need to learn from that experience. So maybe there is some, not guilt in a bad way, but like, okay, really genuinely, I could have done that better, or I could have been there for the patient in a different way. And then processing that and then moving on and doing better next time. So I don't think my boss and longtime supervisor, Julie Cohen, when I was in training, said to me, and I know she got this from somebody somewhere else. I don't know where she got this from, but I kind of asked her this question, and she said, "Actually, Anna, what happens is you elicit the family's stories and they wash over you and through you and out of you and change you forever." So that's really an image that I like hold on to. So
Yeah.
like when I have a really hard client, like I want that experience to wash over me and through me and out of me because I can't let it pile up. It's when it piles up that you leads to burnout. But like change me forever so that I'm a better counselor, I'm a better human, and I'm a better educator, to share those experiences with other people, and then kind of let it go. And so that gets to the second part of your question. I shared I'm religious, so I have like prayer, I have my community, who's really supportive. I also am a part of a supervision group with Kendra Shaw, which is I think there are 5, 6 of us genetic counselors now in that supervision group that will bring tough cases through and talk through, and they're just really encouraging and supportive. My team at Kennedy Krieger, where I work now, is super supportive if I ever need to talk through a case. Yeah, and just doing. I mean, I've been to therapy off and on, doing that hard work of processing those cases, even when they do affect you, and letting them affect you.
I appreciate what you said Julie had shared because I think that is an excellent way to look at it because it's taking it in, but not necessarily holding on to it because I think there are times where you feel drawn to either building up your armor to not take it in or to
Mm-hmm.
compartmentalizing. So it's not, and I find that doing that has always led me to more exhaustion or perhaps
Mm-hmm.
move me
Mm-hmm.
closer to burnout. And
Mm-hmm.
some of those strategies don't work as well.
Oh, so I was practicing through my cancer diagnosis and through our daughter's everything that went on with her. And then I got to a place where I was completely toast, completely burnt out. And I was like, I cannot, like, the patient sitting in front of me is processing the exact same thing that I am, still in the exact same phase they are in processing these questions. And I took a year completely off and then a year doing my own business, lots of things, a lot of work during that time to get myself to a more healthy place to where I felt like I could re-engage with clients in a better way. And so that might mean that we need to be self-aware enough and we need to say, you know what? Careers are long in general. I can take a year and I can step back and that's not going to ruin my life trajectory to step back in order to care for where I am at mental health wise for myself.
Right, right. And that's so important, I think, to remind anybody who is practicing or getting ready to practice in this field is that it is possible to take a step back or to not give 150% and still have a career that that develops in the way that you want and that you hope. But there are some times where you're going to need to either take a step back or just do the bare minimum, and that's okay.
Yeah. 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 Absolutely. I had a thought from what you were saying.
Yes.
Yes. And then, oh, like, so from my own experience, taking that year off, I would say has been one of the most fruitful things for growing my career. Taking that, and I also acknowledge that, like, I have a spouse who has a job that allowed me to be able, like, not everybody can do that.
Right.
And felt very, very blessed to be able to step back, get to a healthier place. But then that allowed me time to think more creatively and to think on these questions and be like, when I go back to re-engage, who do I want to be? What do I want to do differently?
One thing I did want to make sure I asked was about living with uncertainty. And so I know, like with our patients with a genetic risk or a genetic diagnosis, it still doesn't tell you here are all the things you're going to expect and experience in the timeline, right? It's still very uncertain. And having been a patient and worked in these areas personally too, experienced this uncertainty. How do you think about living well or frame living well when the future is uncertain and there's these other things that you may not be able to anticipate?
Hmm. Yeah, I think for all of us, the future is uncertain, and maybe that is where one of my partly where my experiences came in, especially, yeah, getting the completely out of the blue cancer diagnosis. It's like, before this diagnosis, I thought I was controlling my life. I mean, I hate to say this, but none of us are controlling our lives. And I mean, we have things that we do, like our actions matter, and our decision, and like how we interact with other people matters. So I'm not saying that, but for any one of us, something could happen, and there could be a huge shift. And so, as humans, we all kind of get to a place where we're like okay with the uncertainty of the situation that we're doing.
Mhm.
And I think, and I do definitely think that this is different for different practices or people who work within different fields. For most of the patients that I see, they have been living with uncertainty for years. They've had their child who had developmental delays early on and they were worse, and they're like progressing. And really, I have said this so many times, the most challenging family, or the families that I feel like are in the most challenging place, are those who are like, their child is 2 years old and they're like, I still don't know. Like, I'm so much holding on to the possibility that they will catch up to their peers. I'm holding on to that. And those families, I feel like, is where this uncertainty hits hardest. Because of where the system works, I feel like most of the time I don't actually see the families until after they've worked with the developmental pediatrician and we're actually at 5 and 6 years old, 12 years
Right.
old, 24 years old, and uncertainty is their norm. And this is what they're doing. And so, but to go back to your question, for those families who are living in that uncertainty, I do bring up that tension a lot. The idea of like, okay, we can hold on to both the possibility that your child is going to catch up. And I hope, maybe I even pray for that. I hope that for you and for your child. But we can also have this tension of what if they don't? And we can hold those two things to be possible. And you're not crazy for holding them both to be possible. You're not delusional. It's not a false hope necessarily. I mean, maybe for some of our families, we can see pretty clearly that it's unlikely that they will catch up, but still giving them that space to like hold both things to be true until they're ready and they've grieved through that long enough to kind of accept where they're at and where their
Well,
child is at.
yeah, and I will say I think hope, one of the things I took away from my clinical care time was hope was honestly the most, you were talking about resilience, but hope to me was like one of the most powerful things I
Absolutely.
saw time and time again, even
Absolutely.
even if we're like medically, the odds are stacked against us, all this stuff.
Hmm.
There is something to be said for having that hope to continue to put one foot
Hmm.
forward.
Hmm.
Mhm.
Hmm. Yeah.
And I thought it was interesting too what you said about, well, life really technically is uncertain for everybody.
Hmm.
Like we really don't know.
Hmm.
And I think you brought up something very insightful, which is like we don't know. It's very uncertain until we're faced with something that then helps us come to that realization. I am
It
not
like
in
forces
control.
us.
Yes. And so I think that's also a good way to look at it is like really everything's uncertain. We just maybe believe one thing until we're vehemently confronted with like that's
Hmm.
not the case.
Hmm.
And so I think too, it's important to note too, like you said, for a lot of folks that we as jet counselors would be working with, they've already been in a space of uncertainties. it's not just because things are uncertain and unknowable doesn't mean that there's not meaning.
Yeah. Yeah, absolutely. And they are experts in doing this. Like, they have readjusted this hope over and over and over again. And so we can draw on that in our counseling of like, when you first got this, like, tell me your story about when you first heard that your child had autism. Like, how did you adjust to that? How did you adjust to when you had to realize that they wouldn't be on a diploma track? When he's like, and then use that to like, because they will say meaning statements in how they do that of like, what are the things that got them through that was meaningful? And then now I'm giving you this genetic diagnosis. We can do the same thing again with making meaning and understanding and processing this new genetic diagnosis.
And I think we've kind of covered this ongoing throughout the conversation, but kind of, who you are as a genetic counselor now versus, early in career. But looking back, are there things that you wish that you knew maybe about genetics and meaning or understanding what living well means earlier in your career as a genetic counselor?
I think as far as like understanding meaning, that is something that takes time to unpack. And so I don't without the experience, and everybody has their own experiences. So everybody, it's going to be different for each person. But I don't think I would have gotten like there's no way I could have had the knowledge that I have now. It just is impossible at 18. What I wish I would have known is that like it'll all be okay. Like just that like it'll all like I had so many worries and so I struggle with anxiety, so many anxieties. It's like I'm so worried that I would hurt a patient or say the wrong thing or mess something up. And some of that and sorry, let me finish my thought. And so like getting to a place like it's gonna be okay. Like you might misinterpret something completely wrong and somebody else catches that mistake and it's your bad and it was not intentional and it might have like significant negative consequences, but even that is going to be okay. Not that we want that to happen, but even that is going to be okay. And so, yeah, if I could go back to my younger self, like it's going to be okay and give yourself a little bit of grace. You're trying your best, you're doing the right things, and move forward.
Yeah, I think it's you have your values. What do you want to be proud of as a
Hmm.
provider? And but then also knowing there are going to be times that you don't say the right thing
Hmm.
and it's okay.
Hmm.
I think you do, like you said, you get so worried about breaking something that can't be repaired.
Yeah, yeah. And there's a beautiful human thing about that. Like
Mhm.
being able to make a mistake and learn from it and use it to help others. Like that's such a human thing. And it's amazing.
Is there one thing that you would want listeners to take away today or one thing that you would want them to remember?
I think to like do the work for yourself, like start with yourself. Like you're not going to be a good provider until you start with yourself. So whether that's going to counseling or getting training, but like even like around meaning, like what as a genetic counselor, why do you do this work? Why do you keep going? Especially this is extraordinarily mentally exhausting, sometimes physically exhausting when you've been in clinic all day long, emotional exhaust. Like why do you keep going? And so like asking yourself those questions, I think will guard against burnout because you can like Viktor Frankl, who's the person who originated logotherapy, he says that humans, if they have meaning, can endure all types of suffering. And so like and sometimes our job is suffering. And so like, but if you have meaning of like why you're doing this and what you're doing and what keeps you going personally, like that can get you through the hard clinic day when you're exhausted. Yeah.
No, excellent. I think that is so important. And Anna, just thank you so much again for sharing, your personal story as well as your experience with patients and for being on the show today.
Yeah. Thanks for having me. This was a joy.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all the episodes of the show. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Please rate and review the podcast on Apple, Spotify, YouTube, or wherever you listen. This helps other people like you discover the show. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. All Access DNA is an independent podcast hosted and produced by me, Kate Wilson. Designs by NKJ created the logo. Thanks for listening and join us next time.